ਹਸਪਤਾਲਾਂ ਦੇ ਵਿੱਚ ਸਟਾਫ ਦੀ ਕਮੀ ਤੇ ਚੱਲਦਿਆਂ ਓਨਟਾਰੀਓ ਦੇ ਕੁਝ ਹਸਪਤਾਲ ਸਰਜਰੀਆਂ ਨੂੰ ਰੱਦ ਅਤੇ ਮੁਲਤਵੀ ਕਰ ਰਹੇ ਹਨ, ਜਿਸ ਮੁੱਦੇ ਤੇ ਵਿਰੋਧੀਆਂ ਵੱਲੋਂ ਫੋਰਡ ਸਰਕਾਰ ਤੇ ਨਿਸ਼ਾਨੇ ਸਾਧੇ ਗਏ ਅਤੇ ਕਿਹਾ ਗਿਆ ਕਿ ਕਿੰਨੇ ਬੱਚੇ ਹਨ ਜੋ ਵਾਇਰਸ ਦੇ ਸ਼ਿਕਾਰ ਹੋ ਗਏ ਹਨ ਅਤੇ ਅਜਿਹੇ 'ਚ ਹਸਪਤਾਲ ਜੇਕਰ ਬੰਦ ਹੋ ਗਏ ਤਾਂ ਬੱਚੇ ਹੋਰ ਬਿਮਾਰ ਹੋ ਜਾਣਗੇ। ਵਿਰੋਧੀਆਂ ਵੱਲੋਂ ਇਸ ਸਾਰੇ ਲਈ ਫੋਰਡ ਸਰਕਾਰ ਨੂੰ ਜ਼ਿੰਮੇਵਾਰ ਦੱਸਿਆ ਗਿਆ, ਜਿਸ ਤੇ ਬੋਲਦਿਆਂ ਓਨਟਾਰੀਓ ਦੀ ਸਿਹਤ ਮੰਤਰੀ ਦੇ ਵੱਲੋਂ ਆਪਣੀ ਸਰਕਾਰ ਦਾ ਬਚਾਅ ਕੀਤਾ ਗਿਆ ਤੇ ਕਿਹਾ ਗਿਆ ਕਿ ਸਾਡੀ ਸਰਕਾਰ ਵੱਲੋਂ ਜਲਦੀ ਹੀ ਇਸ ਸਮੱਸਿਆ ਨੂੰ ਹੱਲ ਕੀਤਾ ਜਾਵੇਗਾ।
Question period is underway. Let's listen in.
Fever, vomiting, and had low oxygen levels. Speaker, our youngest children are sick and suffering because this government didn't do enough to prepare for this crisis. I asked the Premier, how many more kids will have to wait long hours for care before this government takes action to relieve the burden on hospitals and ensure our kids get the care that they need?
The Deputy Premier and Minister of Health.
Thank you, Speaker. You know, it is obviously deeply disturbing for all of us to hear stories about parents who have to wait with their children as they get admitted, as they are waiting for that bed to open up in the hospitals. But I also think it's important for us to understand and appreciate that these are not new issues and not new problems. We were left, frankly, with a health system that was in dire need of investments. Our government has made those investments. We continue to make those investments. We are the first government since the last previous Conservative government to open up 2 new medical schools in the province of Ontario. We will continue to do what is right and what is needed. But yes, I do find it disturbing when we hear stories about how parents have to wait for that bed to become available and the child to ultimately be in a hospital room. Thank you.
Supplementary question, the member for London West.
Thank you, Speaker. Again to the Premier. We also heard yesterday that Children's Hospital at London Health Sciences Centre announced the heartbreaking decision to cancel surgeries for sick children. Inpatient bed occupancy is higher than any other time during the pandemic, despite the hospital's efforts to expand capacity and to move children to the adult ICU. The Director of Pediatric Critical Care says the crisis is getting worse every day and they don't know how long the cancellations will last. Speaker, we've been hearing that this government has a plan for the crisis in our pediatric hospitals. How can the Premier possibly defend a plan that causes sick children and their families to suffer?
Thank you, Speaker. I've said it before and I will say it again. Status quo isn't working. We have put in place with our partners, including Ontario Health, constant contact with pediatric hospitals, Ontario Health, primary care practitioners, community health centres, to make sure that everyone is working at full capacity so that we have access to the care we need. I understand this is very challenging when we see these surges, when we see increases in viruses such as RSV, when we see increases in influenza. What I would ask respectfully is that all of us make sure we are part of the solution by encouraging our constituents to get that flu vaccine. If you haven't yet received your booster shot for COVID-19, do it. That will make a difference in our hospitals, in our primary care facilities, and ultimately protect our children.